Lewy body dementia. Lewy body dementia is also known as dementia with Lewy body. This is the second most common type of progressive dementia after Alzheimer dementia. This is the third most common dementia after Alzheimer and vascular dementia. To remember Lewy body dementia, there's a triad. Number one, it has progressive decline with memory. Number two, it might have visual hallucination and rapid eye movement sleep disturbance. Number three, it includes Parkinsonism disease signs and symptoms, which includes rigid muscle, slow movement, walking difficulties, and tremor, and also includes mask-like face. Symptom progression of Lewy body dementia. In the early phase, it has visual hallucination, restlessness, rapid eye movement, sleep disturbance, movement difficulties, and urinary issues. As it progresses to middle stage, it has motor impairment, sleep disturbance, decreased attention, paranoia, and confusion. The latest stage, it has extreme muscle rigidity, sleep disturbance, sensitivity to touch, dementia, and risk of infection. In terms of etiology, it is caused by abnormal deposit of protein called alpha sequinae in the brain. These deposits are called Lewy body, which affects two chemicals in the brain, mainly the neurotransmitter dopamine and acetylcholine. If it impacts dopamine, especially in the substantia nigra, ventricular tegmental area, and hippocampus of the brain, it causes symptoms of Parkinsonism disease. If it affects acetylcholine in the hippocampus, it causes memory problems similar to Alzheimer dementia. Risk factors include age. Older than 60 are at greater risk. It impacts male more than female. Family history with Lewy body dementia and Parkinsonism disease are at high risk. Assessment, biopsychosocial approach. Biological blood tests are done to rule out other conditions that mimics Lewy body dementia. MRI and CT scans are done to rule out stroke, bleeding, and tumor. There are some advanced scan like PET scan to assess the brain function. SPECT, which is single proton emission computerized tomography, it shows reduced dopamine transporter uptake in the brain, especially with Lewy body dementia. If you look at neuropsychological test, detailed neurological test needs to be done. Number two, assessment of memory needs to be done. The usual memory test done is cognitive test is Edinburgh Cognitive Test. Score of 82 indicates cognitive decline. Social, collateral family history, GP referral, occupational therapy, and social report are needed. We have to keep in mind there's no test that can definitely diagnose Lewy body dementia. In terms of treatment, biopsychosocial approach, the medications are just to relieve the symptoms. The medication includes acetylcholinesterase inhibitors. This is to address memory problem. Rifastigmine has got the best evidence for Lewy body dementia. For Parkinsonism symptoms, carbidopa and levodopa are indicated to reduce muscle rigidity and slow movement. However, this medication causes confusion, hallucinations, and delusions. We need to be mindful of prescribing antipsychotic drugs because it might worsen Lewy body dementia symptoms. Alternative medication includes music therapy, pet therapy, agrotherapy, muscle therapy. Care supports is vital. Patients as well as family members needs to be advised on legal, financial, and healthcare matters for the future. This all psychological treatment are indicated to promote relaxation. In terms of social, if the medications are not indicated, they need to be reduced or stopped. If the side effects are mainly hallucination, the environment needs to be catered as per the need of the patients. The daily routine and structure needs to be maintained to support patient with Lewy body dementia.